Okay, good morning. My name is Liane Feldman from Montreal, and I'd like to echo Dr. Fuchshuber and Dr. Schweitzberg's comments, and thank you for attending today. We are going to really be looking forward to your comments. You have a survey in front of you. Unfortunately, I just looked at it, and about only the first half of the content is represented. We're going to work on that and get the second half to you in a minute. It's a little different than what we've asked from you from other surveys. It's not so much, do you like the slides and so forth. It's really about the content. Is it covering the content? Is it what you think should be covered in that area? So if you could fill those out as you hear the talks, it would be very helpful. You leave them on your table and we'll collect them. The first thing we'd like to do is a pre-test. You're not being graded. It's anonymous. The purpose of the pre-test is really just to focus your attention on some of the content that the speakers wanted you to really attend to. And so we're just going to go through that. Some of you I saw were already filling it out, good students that you are. But we're going to take a few minutes. We're just going to go through that together. These are my disclosures with some grants from those companies. So the first question, in the electrosurgical circuit below, what is the arrow pointing at? Is it the active electrode, dispersive electrode, electrosurgical unit, or ground electrode? So we'll just give a few seconds to answer that. Also, if you have a second, if you wouldn't mind, it's anonymous, the test, but if you put down just what your practice setting is, are you a surgeon in practice, a surgeon in training, a student, allied health, that would be helpful to us as well. Okay, next question. As a laparoscopic cholecystectomy is about to start, the surgical drape catches fire from the fiberoptic light cable that we turned on, but we didn't connect yet to the laparoscope. The immediate next step should be to A, disconnect the breathing circuit and remove the endotracheal tube. B, pour saline on the drapes to extinguish the fire. C, apply fire blanket to smother flames. D, remove burning material from patient. Or E, put out the fire with a fire extinguisher. Okay, we're going to move on. Number 3. What is the best explanation for the selection of an output for sealing an artery with monopolar grasping forceps? A, coagulation output, because the higher voltage provides the most effective and consistent method to denature proteins in the vessel wall. B, blend output, because it heats the electrode surface more evenly and provides additional pulses of energy to improve the quality of the seal. C, cutting output, because the continuous low voltage output elevates the intracellular temperature of the cells more evenly. Or D, none of the above. Okay, number 4. The surgeon has selected a bipolar tissue fusion device to seal and divide blood vessels in the colon's mesentery. Which of the following statements is incorrect? So you pick the one that's false. A, tissue temperature rises due to the effects of radiofrequency electricity on the cells in the tissue between the blades. B, the dispersive electrode is placed over the patient's back or gluteus muscle. C, mesenteric blood vessels can be safely sealed and divided. D, thermal injury may extend beyond the tissue grasped in the instrument's jaw. Pick the false one, please. Number 5, radiofrequency ablation is based on A, high frequency alternating current, B, direct current, C, low frequency alternating current, or D, pulsating current? Okay, we're going to move on. Sort of a quickie. Number 6, a pedunculated polyp is identified by colonoscopy. To minimize the chances of post-polypectomy bleeding, the surgeon selects the following setting or settings for the electrosurgical unit for colonoscopic snare polypectomy. A, cut mode, B, coag mode, C, bipolar mode, or D, radiofrequency energy mode. Next question. Number 7, the effects of ultrasonic energy on tissues include A, mechanical cutting, B, coagulation, C, cavitation, D, all of the above. Number 8, the main functions of functions of a cavitational ultrasonic surgical aspirator or CUSA device is A, aspiration, B, irrigation, C, fragmentation, D, all of the above. Almost done. It goes to 11 though, like in spinal tap. Number 9, renal malignancies can be treated with both radiofrequency and microwave ablation technology. An accurate description of the differences between these two devices includes A, both technologies require a dispersive electrode. B, only radiofrequency ablation technology requires a dispersive electrode. C, only microwave ablation technology requires a dispersive electrode. D, neither microwave nor radiofrequency ablation technologies require a dispersive electrode. Okay, number 10. A 15-pound infant undergoes open appendectomy for acute appendicitis. The surgeon will use a monopolar instrument. Considerations for placement of the dispersive electrode includes A, the infant's back is an appropriate place for the dispersive electrode. B, dispersive electrodes are only available in one size. C, the dispersive electrode should be cut to fit on the infant exactly. D, there is no risk if fluids pool on the dispersive electrode. Okay, so the final question, number 11. Which of the following will not cause electromagnetic interference with cardiac rhythm management devices? Which does not interfere with these devices? A, argon beam coagulation. B, radiofrequency ablation device. C, ultrasonic shears. D, monopolar endoscopic snare. Okay, that's the quiz. So thank you. We're going to be collecting those, and thank you very much. And here's Pascal again.